Performing Risk Assessments and Developing Fatigue Management Plans, prepared by Kylie Apers. Early in fatigue management, hours spent at work and hours spent sleeping were the main target areas. As well, the program tended to be more reactive after an incident had occurred than proactive, based in prevention. However, the causes of fatigue are multifactorial, and so a comprehensive and effective management plan would need to address other factors than work hours alone. So whose responsibility is fatigue management? The Alberta Occupational Health and Safety Act dictates that employers ensure the health and safety of workers at their site, and workers take responsibility to protect the health and safety of themselves and other workers. So whose responsibility is fatigue management? It's a shared responsibility. In a fatigue management plan, the responsibilities are similar. The organization provides systemic support, including implementing policies to promote well-being, procedures to manage and monitor fatigue, data gathering and analysis, training and education to employees. The manager or supervisor ensures compliance to the plan and acts appropriately to fatigue-related incidents, errors, or behaviors. The employee has the responsibility to be fit for duty and report cases of fatigue so they can be avoided in the future. What is a fatigue management plan? Fatigue management plans can be described as a set of policies, beliefs, and procedures for monitoring and managing the risk posed to health and safety by fatigue. In general, the main components of a fatigue management plan are: identify factors that can contribute to fatigue, assess the risk created by these factors, implement and maintain risk control measures, and review or audit the effectiveness of the control measures. Identify all foreseeable factors which could contribute to and increase the risk of fatigue. As we've discussed, the causes of fatigue are multifactorial and stem from many areas in one's life. Some examples may be drawn from job demands, sleep, or non-related work factors. A fatigue-related risk assessment aims to assist in prevention and health promotion efforts by exploring the possibility and degree of fatigue-related harm. A risk assessment can be done on an individual and organizational level. It can also be simple or complex, depending on the situation, information, and resources available. For example, it can be as easy as having a discussion with a manager, or a manager using a specific tool or algorithm to calculate the team's risk. Important questions to ask in risk assessment are: where is the fatigue-related risk highest? When does it occur? Who does it impact? Are the existing control measures effective? What action needs to happen to control the risk? And urgency. The Sam Perelli Fatigue Checklist is one example of a tool which can be used to assess fatigue risk. Implement and maintain risk control measures. Control methods or defenses aim to eliminate or minimize the risks that have been identified. In short, once the factors contributing to risk are identified, strategies to reduce the risk can be implemented. Education and training should be available to all staff. Education about fatigue aims to create understanding and awareness and is another strategy to decrease risk. Review, audit the effectiveness of the control measures. Once control measures are in place, they need to be monitored and reviewed to ensure effectiveness. Frequency of review can be determined based on the level of risk, or it can be reviewed when there is the introduction of new schedules, working hours, equipment, tasks, there is indication a risk is not being managed, an incident occurs. Incident investigation is a process of collecting adequate information and determining whether the individual was impacted by fatigue. It will examine many performance areas and may use objective measures, like the Occupational Fatigue Exhaustion Recovery Scale. Checklists and other measures can be used throughout the fatigue management plan. The first 3 resources are available in the reference list. and include a variety of tools and planning steps. The Registered Nurses Association of Ontario put forth a resource available here, which includes tools such as the Occupational Fatigue Exhaustion Recovery Scale, the Pittsburgh Sleep Quality Index, and the Epworth Sleepiness Scale. In summary, a fatigue management plan is an inherent and integrated process in the workplace of healthcare professionals that aims to increase safety for staff and clients.